Marco Cappa. I am actually the head of the research unit for innovative therapy in endocrinology at Bambino Gesù Children's Hospital in Rome. This webinar session is very, very important because we'll focus on the digital decision making in the management of growth disorder using the new tools, in particular AI tools, that is the new area for pediatricians that are working with growth hormone disorder. This webinar will be presented by myself, but there are two important speakers. Professor Paul Dimitri from the University of Sheffield, a leading expert in child health technology and pediatric endocrinology. Dr. Paula van Dommelen from TNO in the Netherlands and an international recognized scientist and statistician. She is an expert in the electronic device and working with a lot of patients with growth hormone deficiency, focusing on adherence of treatment. The webinar will be digital decision making and the management of growth disorder, which will take place on Friday, 16 October 2026 from 1 to 2 CES time. The educational webinar has been developed by MEDEA, Medical Education Academy. The webinar is designed for clinicians involved in the management of the growth disorder, particularly pediatricians and healthcare professionals working in primary care, as well as specialist nurses with an interest in growth and endocrine disorder. By the end of the webinar, participants will be active to evaluate the role of artificial intelligence and other technology advance in enhancing the clinical care in patients with short stature. Recognize the value of a height screening program in identify growth-related conditions. Appreciate how digital technology can support adherence to recombinant human growth hormone therapy. The agenda includes two expert presentations. First, an overview of AI driver breakdown in pediatric growth disorder, followed by a session on computer assistant modeling for predicting the height outcome in children with growth disorder. We will then conclude with a discussion and a question and answer session before the final summary and closing remarks.
Digital solutions are being increasingly adopted to aid the management of growth disorders. How is this impacting, firstly, clinicians, but also patients and their families?
This is a crucial question because the new tools are fundamental. In fact, the actual use of digital tools have been increasing because it's an everyday usual clinical practice. Calculate standard deviation for eyes, standard deviation score for height, weight, BMI, and eye velocity. Before this, the AI area, every calculation needs time and more frequent errors. So with this tool, it is possible to have more time in the real world important part of clinician evaluation, that is family and patient's history, a direct clinical evaluation. So we will have more time to do the clinical practice in a right way. Moreover, the new device tools have been used for giving the right dose at the right mode in order to reduce even more the lack of a therapeutic adherence.
This webinar will focus particularly on height screening programs. How effective are these in identifying growth disorders? And how cost-effective is their implementation?
As I told before, the use of digital tools improve the calculation of standard deviation for height, weight, BMI, and high velocity. The high velocity is the most important relevant parameter that gives the real efficacy of treatment, and in few seconds, if it is possible, calculate important data, extremely useful for judge the positive or not effect of the therapies, in particular growth enhancer drug. Moreover, using the digital tools, it is possible to tailor better the therapies based on each individual patient. So using digital solution, the clinician it is able to adapt the therapy at each patient's needs. I invite you to participate to this webinar that will presented in October 16th, and I suggest to participate to all people that are working with the patients and will need to use the new electronic tools, electronic method to judge and to confirm therapy with the growth hormone deficiency. This is an important webinar that I think will look at the future for the clinician to save time and use more time for the patients. I hope you enjoy the webinar and find the decisions both informative and clinically relevant.